the cancer blocking shot, everything you need to know about the HPV vaccine.
Today we're going to talk about a vaccine that can prevent cancer when our children become older. Our special guest today is Carlos Marquez with Mesa Winds Pharmacy. Our crew today is Bobby Hockaday and Joyce Runyon, and I am Brenda Bishop. Carlos, thank you for joining us today. I'm excited to get into this topic, but first, I would like just to hear a little bit about you. It's exciting that we do have a new pharmacist because we're down to one. So we really are glad that you moved back, brought your family back to Quay County. And so tell us just a little bit about you and your education.
Well, thank you, Brenda. Yeah, as everyone already heard, my name is Carlos Marquez. I have two boys. One of them is 9 years old and one is 3 years old. And my wife, Mercedes Marquez, she's a nurse instructor at Mesa Lands Community College. She did some home health stuff here at Presbyterian for a couple of years, and now she's instructing the nursing students there at Mesa Lands. I was born and raised here in Tucumcari and was a product actually of Tucumcari Public Schools. And when I was in high school, I worked at Bob's Budget Pharmacy, the pharmacy that used to be here along with Wellborn's. And I was with Bob and learned from Bob there throughout high school. I was there for the 4 years. And then whenever I was in my senior year of high school, I actually, someone from the College of Pharmacy came to the high school and was talking about a program. And so it piqued my interest, and so I was already working at the pharmacy. And so I went ahead and applied for this program. And at the time, which this program no longer exists, I think a couple of years ago was the last class that went through. It was the UNM NMSU Cooperative Pharmacy Program. So it was kind of a relationship between UNM and NMSU to get pharmacists in the southern parts and southern and rural parts of New Mexico, because the majority of everybody that graduated from pharmacy school tend to focus and stay in, Albuquerque, Santa Fe, and those areas, and left kind of a shortage everywhere else. As you stated, it's hard to come by pharmacists around here. And so I applied and was part of that interview. And, I was a senior in high school, 17 years old, going to the College of Pharmacy, did my interviews there, got accepted, and then went down to NMSU and did my 3 years of prerequisites down there. Went up to UNM, and then got my Doctor of Pharmacy there, was there for 4 years, did that. So a little bit about the education. So all the programs in the United States now, I think sometime in the 2000s, they all transitioned from a Bachelor of Science degree in Pharmaceutical Sciences to now it's a Doctor of Pharmacy degree. So the majority of regular track students or students that go through it get their Bachelor of Science degree, whether that's in biology, chemistry, biochemistry, some kind of bachelor degree. For myself, it was an accelerated program, so I just did my prerequisites down at NMSU, which included all the basic sciences. Then, like I said, I went straight to pharmacy school. And any pharmacy school now is kind of changed from what it used to be. It used to be more of a medication-driven, how do we make this medication? How do we, do these things with the medication, just solely focused on the medication. And what it has changed is they've incorporated or added a lot of the therapeutic aspects. So within the 4 years that I was in pharmacy school, we did, basic, like I said, we did some biochemistry that was specific for medications, pharmacology, things like that. But about 2.5 years of that was strictly for what they called pharmacotherapeutics. So what we did was we would learn a disease state, whether that was hypertension, diabetes, infectious diseases, things like that. So you would learn about those disease states and what causes them, and then you get into the medication, learn how the medication works, what it does, how it targets those specific areas of the disease state, and then side effects and all the things that come along with the medications. So that's where it's kind of shifted from solely being concerned about the medication to then now adding a lot more of those guidelines and things with those disease states and how to treat it. So it's a pretty rigorous program compared, to what a lot of people think pharmacy is. It's pretty intense.
And so since it's such a more rigorous program and it's a doctorate program now, that's what authorizes you to be able to prescribe and give vaccines.
Yes. So here in the state of New Mexico, it's we have 6 things that we actually can have prescriptive authority for, and all you do, we at the UNM College of Pharmacy, they integrate it into our schooling. So we can do prescribe naloxone, which, now it's over the counter, so it's not such an issue. But we can prescribe naloxone. We can prescribe vaccines and give them. We can do hormonal contraceptives or emergency contraceptives, smoking cessation. We can do tuberculosis testing. And I'm trying to think of what the last one is.
But quite a few services
Yes.
to save you that time of having to get an appointment and...
Correct. Yes. So those are the ones that you can do here in the state of New Mexico without having to go to a doctor. I only have my immunization certificate now because you have to keep up with trainings and stuff like that. So with my demographics and what I was doing at the pharmacy, I decided to just keep my immunization one.
But it's still a great service for us.
Correct. Yes.
So we're here going to talk about human I can't even say it.
The human papillomavirus.
Papillomavirus.
Yep. Papillomavirus.
And I can remember when this came out and my daughter was young and go to the doctor and they tell you all the things about this vaccine. It's like, do I really want my daughter to have this? So I think it was really billed wrong to start with. But can you tell us what the vaccine is actually preventing and why it's important that our kids get it?
Yes. So as you stated, the short for HPV or the human papillomavirus vaccine is used to prevent infection of HPV, again, a virus in humans. And the human papillomaviruses it's not just one specific virus. There's actually kind of a family or group of viruses, what they call it.
Okay.
And the current vaccine, which is the Gardasil 9, used to be Gardasil, now it has 9. It covers 9 types of the HPV. 7 of those are actually known to increase the risk of cancers, more specifically cervical cancer, the cancers in the anal genital area, and then also oropharyngeal or like neck, mouth, and head cancers. So this vaccine prevents the infection of the virus that increases your risk for those cancers. And I think where there was a lot of confusion was the HPV or human papillomavirus is a sexually transmitted infection. So I think that's where a lot of, people have some hesitation towards getting the vaccine. But, looking at it in the long end, it's to prevent cancers that are caused by a virus that is transmitted sexually. Okay. And that's kind of the basis of that. And then...
So now it was originally just for girls, but I went to a meeting last year and they were talking about boys getting this. And I'm like, really? Boys need this now? So tell us a little bit about the new recommendations, age groups, those kinds of things. Yeah,
so the ACIP recommendations now, what they're recommending is that all boys and girls from ages 9 to 14 get vaccinated. They're generally recommending that you do it at 11 or 12 years old, but you can do it as early as 9 years old. And it's a 2-dose series vaccine from, like I said, Gardasil 9. And you get the initial dose, and then in 6 to 12 months, you get dose number 2. And that's for, again, all the way to 14 years old. Now, if you get started late, let's say 15 to 26 years old, then you have to do a 3-dose series. And ACIP, which is part of the CDC, they're the ones that handle the immunization recommendations. They recommend that everyone 15 to 26 years old as well gets this vaccine. You just have to do a 3-dose series, which is at 0 months, at 1 to 2 months, and then another vaccine at 6 months. And then we'll talk a little bit more about the recommendations and stuff.
So why recommending so young?
So part of that is to do with how this virus is transmitted. So when we talk about it, right, it's a sexually transmitted infection. So children and adolescents tend to become sexually active at a wide range age group. And so vaccinating at an early age prevents this virus from from our children being exposed to this virus at whatever age they become sexually active. And I know that's kind of a hard conversation, for parents to have and stuff like that. But yeah, and as you stated earlier, yes, it was initially for females, and a big reason for that was, if we look at the history of HPV, back in the 80s was when they first discovered HPV. There was a couple scientists that cloned it. And then in the 90s is when they actually figured or saw that it had some carcinogenic or some cancer-causing properties. And at the time, what happened was they were looking at specifically HPV 16 and 18. So those are two of the, remember I said it, they were like a family. Those are two specific types of the virus that cause cervical cancers. So then, that cervical cancer is whenever they were really targeting. So they were targeting that cervical cancer. So when, the people that developed this vaccine, they geared it towards that. And so when they did the study, the first study that was used to get Gardasil approved was only studied in women because they had only discovered that it was cervical cancer.
Okay.
Yeah. So that's why it was, recommendations are all based on studies. Well, if we only study it in women, all we can recommend is that population. It was never studied in men and hadn't been thought of as other issues. So that's why at the time it was only for females when it first came out.
And then they discovered that more cancers are caused by that same virus.
Yes.
Okay. So what about the what's the word, efficacy of the vaccine? How effective is it? Because we hear this all the time. Well, you could still get this if you have the vaccine.
Right. Yeah. And so whenever you part of this is I have the studies here for the Gardasil 9, which is the vaccine that's recommended now. And when you look at the endpoints in terms of efficacy, let's see, here we go. So as you can see here, this is talking about the different types of HPV that the vaccine covers. And there we go. So part of what they did was they took the studies from the original Gardasil vaccine. So the Gardasil original vaccine had 4 strains that it covered. It covered 6, 11, 16, and 18. 16 and 18 were proven to cause cervical cancer. 6 and 11 would cause genital warts. That's what that one was covering for. Then when Gardasil 9 came out, they added 5 more strains. So they added 31, 33, 45, 52, and 58, those of which can also cause cervical cancers, cancers of the head and mouth, any other anal genital cancers. So what they did was they took some of the data from the original Gardasil, because we're still using the same 4 strains and we're making the vaccine the same. We're just adding more strains to it. So when you look at the data, what they did was they took some studies here and they had 7,000 participants, and of those, 6,000 finished the study. So when you compare the original Gardasil, and these are all endpoints here, what they are was there some any cervical cancer, vulvar cancer, or any vaginal cancers. And you can see that with the Gardasil 9, at the end of this study, the endpoints and stuff like that, they had 1 case of people that had the Gardasil 9 vaccine that had any of these cancers. And then the original Gardasil vaccine, they had 30 cases. So when you actually do the statistics, it ends up being about 96% effective for these cancers compared to the Gardasil vaccine. And when you look at that endpoint, what they did was when they originally came with this study out in 2006, those endpoints showed that the Gardasil vaccine versus placebo was about 98% effective. So, when you're looking at effectiveness and you're looking at 96% effective towards those, it's actually a very effective vaccine in preventing cancers.
Well, so that's a whole lot more effective than, say, our flu vaccines or some of those that we get all the time.
Yes, yeah. So, some of those tend to be, the flu vaccine's a little hit and miss. They get, what they do is, that one's interesting too. They there's a trivalent and then there's a quadrivalent. So there's one that has 3 strains, one that has 4 strains. You have epidemiologists that look at the strains that are, I don't know how to explain it, but they look at the hemispheres of the world and what they think is going to hit in certain hemispheres. And so they build the vaccine each year 4 specific strains. And that's why that one's always a hit and miss, because
Right.
all of a sudden you can have a completely different strain that hits our hemisphere, and it's effective 0% against that. So yes, this is a very effective vaccine to prevent cancers. And then the other thing that you had said was about them being exposed, or if everybody's going to get cancer if they don't get this vaccine. So that in itself is part of how this virus works. So as we stated earlier, the recommendations are only from 19 to 26 years old, or 9 years old to 26 years old. Well, what happens to the people that are already 27, 28, older adults? Have they been exposed? Are they going to get cancer? That was a great point, because when we're looking at HPV, by that time, the recommendations state that by that time, people have been exposed to HPV. So they're going to have been exposed at some point or another. And so it doesn't mean that they're going to get cancer. So the way HPV works is it goes into the body. It's a virus, goes into your body, and it actually infects our cells, our human body cells, and it actually integrates part of itself into the DNA. And then that's how it's able to replicate. A lot of viruses do that, to where they go into, the
DNA.
body, integrate some of their DNA into our DNA, and then our body does the work, builds the proteins for it, and then it's able to replicate. HPV does that, but usually the body clears it. So, our own immune system will recognize it, clear it, get it out of the way. What happens is, if you have these, what they call persistent infections, or infections that last a long time with HPV, as that DNA is introduced, there are some genes in there that they call oncogenes, or genes that can cause cancer. And so over time, if you have a persistent infection, those genes will keep replicating and keep introducing themselves, and then cause these overgrowths that become cancerous. And so not everybody that's exposed to it will get these cancers, because your body might clear it, but there is a percentage that will get it because it stays there.
Right. Okay. So we know that we should have it at a younger age, but what if you didn't and you're already sexually active? Can you still get the vaccine?
Yes. So, if you're between 19 and 26 years old, you can go anywhere and they'll recommend the vaccine. It is a 3-dose series. So that's the only difference, is if you get it younger, if you started before 15 years old, it's 2-dose. After that, it becomes 3 doses. And then after the 26-year-old age, the CDC or ACIP makes recommendations as to, you can get it, but you need to have what we call a shared clinical decision-making conversation with your provider. So like we talked about my prescriptive authority earlier, as a pharmacist, I can only prescribe what ACIP recommends,
right?
What they recommend. So if someone came into my pharmacy, at 30 years old and says, I want the Gardasil 9 vaccine, that's something where I can't prescribe it. That would be something that they would have to have that discussion with the provider, and the provider would have to actually prescribe it. And I could give it, but the prescriber would have to prescribe it, because that's outside of their recommendations. But yeah, from 27 to 45 years old, they recommend, if you're at higher risk or if there's any risk factors, have that conversation with your provider. And if you guys have a risk-benefit conversation and they say, yes, the benefit would outweigh the risk, then yes, that vaccine can be given at that age.
Okay. So if I had a young child right now who was 9 to 11, where would I take my child to get vaccinated with this?
So most pharmacies, CVS, Walgreens, Walmart, those pharmacies carry these vaccines. Fortunately, we don't have any of those pharmacies here. The Department of Health, I know, does some of these vaccines. Some of the clinics might do them. I'm hoping that at some point, once I get the logistics figured out, that we'll be able to offer these vaccines at Mesa Winds. But right now, we're still working on all the logistics for it. But those are the other places where you can go and definitely talk to somebody and try to get it there.
Great. So is there anything else we need to cover with HPV that I didn't think to ask you? Or
let me see my notes here.
I think you told us a lot. I learned a lot.
No, I think that's it. We definitely covered all the big points. And then there's also great side effect information there. I don't know if you have questions
we didn't
about
talk
that.
about side effects.
So it's relatively safe when you're thinking of all things in the big scheme of things. If you look at the safety data, the majority of the issues were pain at the site, injection site pain. So it was like, the majority of people, I think it was like 90% or something like that of the people had pain at the site, which that's expected. It's a needle, you're poking a needle. But swelling at the site, itching, redness and stuff like that was relatively low. And then the other thing was fever and headaches. There was a small percentage of people that got that. But as I tell all the people that I usually vaccinate that ask me about side effects is what we do with vaccines is we're introducing a foreign substance into the body, whether that's a live virus, 'cause some vaccines are live, or a protein from the virus that has been killed, or bacteria. We're introducing something foreign into the body. You would expect your body to have an immune response. You just like when you get a cold, so aches, fevers, headaches, chills, things like that. Those are all things that can be expected with the vaccine.
Okay, so I think you mentioned that you can't currently give this vaccine, but there are some you can give. So you want to tell us what you can do at the moment?
Yes. So currently at the pharmacy at Mesa Winds, I offer shingles and RSV vaccines, and I've worked some logistics through where I think this upcoming fall I will be able to provide flu shots. Unfortunately, I think that'll exclude Medicare patients because of how some of our contracting works at the pharmacy.
Okay. But that's still a great service because we have so few providers. So
yes.
And you don't have to get an appointment and wait 2 weeks. You can.
Right, yeah.
Do they need an appointment, though, for?
Yes. So for shingles and RSV, I do appointments. Right now, with being the only pharmacy in town and the workflow is kind of hard to have walk-ins, so I do ask for appointments. And I offer them on Tuesdays and Fridays whenever there's 2 of us there.
Okay, great. So I guess since you need appointments, we better give them a phone number?
Oh, yes. And our phone number at Mesa Winds is 575-461-2784.
Thank you. So we want to thank you for coming to be part of our podcast. We have a cell phone holder for you. And we'd love to have you back talk about some other things that you were so interesting, just so many things. But thank you for coming, and we appreciate that. And thank you all for joining us for this episode of Health IQ Podcast. And please come back next week as we'll have another topic for important to your family.
Special thanks to our guest contributor, Carlos Marquez, Doctor of Pharmacy, Registered Pharmacist from Mesa Winds Pharmacy, and our host, Brenda Bishop, Quay County Health Council Coordinator.
Podcast crew. Director, Robert F. Hockaday. Producers, Robert F. Hockaday and Joyce Runyon. Camera operator, Robert F. Hockaday. Second assistant operator, Joyce Runyon. Editor, Joyce Runyon. Music provided by David Morris. Funding for Health IQ provided by a New Mexico Better Together grant. Brought to you by the Quay County Health Council. Follow us on YouTube, Facebook, and Instagram at Quay County Health. If you have any content ideas, reach out to us by email, healthikpodcast@gmail.com. More info about this topic and more available on our Health IQ blog, QCHEALTHCO.uncil.org.
This podcast was created solely for educational and entertainment purposes. It is not intended as a substitute for advice from a healthcare or mental health professional.